good afternoon, and welcome to all the students that are in the chat room today. My name is Christopher Carter, and I'm the Dean of Allied Health for Renton Technical College. And so what we offer at Renton Technical College, we offer programs as short as 5 weeks in duration, all the way to a 2-year nursing program. Our shorter programs are like a phlebotomy program. It's only 5 weeks. You come into the program and then you actually will train for 5 weeks. And then that 6th week, you will go on what we call a clinical rotation. Generally, our students at Renton Tech are hired on their clinical rotation. A clinical rotation is like an externship. You have to complete a certain amount of hours in order to complete the certificate program. But after they complete the program or the certificate, most of our students are hired within that particular job site. Like I said, we have programs that are extremely short. We have programs that are a little bit longer in length. Currently at Renton Tech, we offer, first program that I'm going to talk about is anesthesia technology. So anesthesia technicians assist the anesthesiologist to manage pain and monitor patients during medical procedures. The program is the first step for students seeking an Associate of Science transfer degree in the field. Courses in this particular program cover all areas such as medical terminology, pharmacology, EKG analysis, and anesthesia equipment principles, as well as anesthesia equipment applications. Students will study and practice at local hospitals. So for that particular program, we have about 30 different sites that students will actually be able to go to complete their clinical hours. And as I said before, 85% of our students are hired on a clinical rotation. The anesthesia tech program is a 7-quarter program, 107 credits. And upon completion, students are able to go to work as an anesthesia technologist. In terms of their salary, anesthesia technologists start off around $38,000 a year on minimum, but with additional training and education, that can go up to around $65,000 or more per year. This particular program is a financial aid eligible program. Currently, because of COVID, the program is a hybrid program. So part of it is done via our LMS, which is Canvas, and part of it is done in the classroom in terms of the student lab. We have our program director. Her name is Gabe Abbott. And primarily what I want, if you're interested in the program, one of the things that I want to talk to you about that is probably the most important part to the program are the admission requirements to the program. One, students must be a minimum age of 18. They must have their high school diploma at the time of enrollment. You have to take a placement test for English and math. And then once you're accepted into the program, then you have to do a background check and you have to do your annual immunizations. And that doesn't include the new vaccine. That includes things like tuberculosis, influenza, tetanus shot, hepatitis, and measles and mumps, and things of that nature. Once you finish the program again, you are hired and you will actually get a chance to go out and work in hospitals. One of the other programs that I want to talk about is Central Service Technician. Central Service Technicians work in healthcare facilities to prepare and sterilize devices and supplies used to care for patients. So basically, they're in a surgical center, and all of the actual instruments that surgeons use are actually sterilized and cleaned by a Central Service Technician. Our program offers the training and clinical experience to become certified. It can also be a first step toward a career in healthcare. Coursework includes an overview of microbiology, disinfection and sterilization procedures, surgical instrument identification, and more. The program includes an internship at a local hospital, and this particular program is only 2 quarters, so it's extremely short. 2 quarters, which is 22 weeks. It's 30 credits, and once you complete those 2 quarters, you go out to your internship. And again, a lot of our students are hired onto their clinical rotation after they complete their clinical rotation. In terms of career information and how much money they make in the beginning, as an entry level central service technician, they start off at around $40,000 a year. So not really a bad salary considering that the program is only 2 quarters. And so generally, a lot of times I'll get students that will ask me, well, if I go to this program, what can I do next? Well, the program that is connected to this one, or what we would consider a guided pathway, would be surgical technology. They are directly related to each other. The only difference is that the surgical technology program is an actual degree program. That will be the only difference. And it's a little bit more training and a lot more money in terms of the completion of the program. The next program that I'm going to talk about is dental assistant. Our dental assistants are an integral part of the dentist's office, helping both dentists and their patients with procedures and administrative tasks. The program prepares students to become certified dental assistants. Instruction includes training in first aid, dental sciences, radiology, dental materials, clinical procedures, infection control, lab procedures, preventive dentistry, business administration, and basic skills in communication, human relations, and psychology. Students will practice their skills in the RTC Dental Clinic and during externships. So basically, we have a dental clinic on campus, and so our students are actually there. They are supervised by dental hygienists and actual dentists, and they practice on real patients throughout the year. As far as the career objectives for a dental assistant, they make around $35,000 a year starting off. This particular program is 5 quarters because it's an associate transfer degree. So once you finish here, you get your associate transfer degree, and then you can transfer into a bachelor's of science program for dental hygiene. And then some of our students, after hygiene school and getting experience, some of them actually apply to go to actual dental school. So we have alumni now that are actual dentists. One of the other programs that I want to mention is massage therapy practitioner. Healthcare does not get more hands-on than that massage therapy. Massage therapists help patients to deal with pain, injuries, and stress through touch and manipulation of tissues and systems. This kind of therapy has been essential in sports medicine, physical therapy, and wellness programs. Students in our program will learn and practice techniques such as Swedish massage, deep tissue massage, myofascial release, hydrotherapy, and hot stone massage. The program includes a practical externship. The program also prepares students to work in chiropractic clinics, physical therapy clinics, acupuncture clinics, and massage clinics. Graduates will take the massage and bodywork licensing examination to meet the licensing requirements for Washington. Students are also required to join the American Therapy Association and its Washington State chapter. That cost is not included in your tuition. This program is a 3-quarter program, but it also has what we call stop out points. You can obtain a certificate in the massage program in 3 quarters. Most students will opt for the Associate of Applied Science degree or the Associate of Applied Science transfer degree. Now, the difference between just a regular or general Associate of Applied Science degree and a transfer degree, the transfer degree means that if you complete our program at Renton Technical College, any of our programs that have an Associate of Applied Science transfer on it, that means that we have affiliation agreements with universities and colleges throughout Washington and the United States. That means you can transfer your credits toward a bachelor's degree or a bachelor's of science degree in a healthcare related field. So a lot of times I'll get the question about that. Will these credits transfer to a bachelor's degree? And the answer to that is yes. Do I have any questions about any of our programs thus far? Any questions at all about the allied health field and what we offer at our school?
Feel free to unmute yourself and ask a question one at a time in orderly, or send it in the chat. Oh, there's one in the chat. Do you offer, oh no, diet?
No, actually we do not. But I can refer you to Bellevue College, I believe has a dietetic program. Any other questions? One of the other factors that I want to mention to you, since all of you are high school students, is that we also have a Running Start program. And so what that means is I have high school students as young as 16 that are in some of our programs. And so basically when they graduate from high school, they're also graduating with either an associate or a certificate, an associate degree, or an associate transfer degree. A lot of times I talk to parents about tuition. I talk to parents about a smarter path to a bachelor's degree. Most students in the area want to either attend UW or Washington State and some of the other area universities. You said you're only a freshman currently, but you're interested in becoming a registered dietitian. So what I would suggest, the recommendation that I would give you is this. If your school has a CTE department, you should contact your CTE counselor or advisor, and you should get into the allied health track within CTE, because those particular classes will transfer over into any of the area community colleges that your particular high school has an affiliation agreement with. So I take, for example, Renton Unified School District and some of the other area school districts. I will take the CTE credits from them that match some of the classes that I have on our campus, and I will give you full credit for that. What pathway do you recommend for aspiring nurses that are still in high school? That's an excellent question. I always get that question. I would say, number one, volunteer. That's number one. Go to your local hospital, and they are constantly looking for high school students that are interested in allied health careers, specifically nursing, that will volunteer in the hospital. The second recommendation that I would give you is to get into a CNA program, Certified Nursing Assistant program, because if you're in a Certified Nursing Assistant program, that will kind of give you a little bit of experience of kind of what nurses see every day. It's not going to be the full experience, but it'll give you that entry level experience of a nursing career. The third part is once you decide that you want to go into nursing school, a lot of the area colleges have what we call a pre-nursing DTA. DTA stands for Direct Transfer Agreement. Basically, when you take those courses, which are classes in math, science, and English, you will take those classes, you'll have to have a minimum 3.0 grade point average. It just depends on the college. For us, it's 2.5 to 3.0. You will come out of the DTA and you will take a test called the, I wanted to say the NCLEX. I'm going blank right now. Where you take your entry level test to get into nursing school. And once you pass that test, generally when you take the test to get into nursing school, a lot of colleges will look for an average score of 60 to 80. Depending on the college, it may be more competitive. You don't need any experience to get into a CNA program at all. That's a great question. You don't need any experience. You can sign up. Most of my students that come into my CNA program, we take, right now we have 2 cohorts of 10 students each. So we have 20 students total. And I would say 80% of my students did not have any healthcare experience at all. And now they're about to finish the CNA program. The CNA program, again, is only 5 weeks. It's intense, but 5 weeks, and you take your national examination. Yeah, I'll send the link right now. You take the national examination test, and once you pass that, then you can actually go to work. So what I'll do, I will put the link in the chat. Let's see. It is a really good program, especially for individuals that are starting off in allied health. And it may be something where you're starting off and you say, you know what, I like this, or I love this. And now I want to move forward with some other programs. So generally, when we talk about pathways, you'll hear that word a lot at colleges. Generally, our pathway can go in a lot of different directions, but it makes a lot of sense because we've designed it that way. I've designed it that way. So basically, when a lot of times when my students come through CNA, their next natural progression would go to medical assisting. Okay, so I have a lot of students. I have students that have been on my campus for the last 3 or 4 years because they continue their education. I had some that were in CNA that are now in nursing. I have some that were in CNA that are now in anesthesia tech, some that are in CST. It just depends on the individual's level of interest. But I would say the majority are in my medical assistant program. And the reason why they go there is because you'll find that in terms of salary, medical assistants make on average about $16 an hour starting versus a CNA is around $11 an hour starting. So they come back, they either get the certificate of completion or most will continue on and get the associate transfer degree. And generally when I'm talking to students about the different type of degrees, my recommendation will be for you to get the transfer degree, because if one day you want to decide to go get a bachelor's and above, you can transfer the units from that transfer degree to your next degree, which will be a bachelor's of applied science. Another question, would you recommend going to community college for prerequisites and transferring that to the university to achieve a bachelor's? I heard it's a good route if you're hoping to save some money. That's an excellent statement, Tina, and that's a smart path. I'll use myself as an example. Currently working on a PhD. This is the second time that I've done it, and I will be paying back student loans until I'm dead. So I would say, yes, you definitely want to take advantage of your community college districts. The community college average per credit is a lot cheaper than the university, obviously. So take your prerequisites, get into maybe a pre-nursing DTA, because the pre-nursing DTA basically are all of the prerequisites for all of the allied health courses. It's not just for nursing. And it was designed that way because the nursing field is so competitive. So I'll have students that won't get into the nursing program, but then they have about 9 other options for their careers. So a lot of times they will say, well, I didn't get into nursing, but you know, the program director came to talk to me about anesthesia tech. This other one came to talk to me about surgery tech. So I think I'm interested in that because they told me exactly what the salary expectations would be. Someone needs to mute, please.
I got it. I muted them.
Okay. But Tina, that's a really good observation. I would say yes to that. Definitely go to the community college, get all of your prerequisites or general education courses completed, and then transfer them to the university. My other recommendation would be to make sure when you're meeting with your counselor that these particular courses are transferable to the university. Because a lot of times that can happen too, where students aren't informed on the different types of courses. You may have a course within math or within English that is not transferable, even though you completed it and got a good grade in it. So it just depends. So definitely meet with the counselors to get a great idea of which classes will be transferable. You're welcome. One of the other programs that I want to talk about that we have, and actually I won't even, I'll talk to these. We have 2 new programs that we're starting next fall. And these programs specifically are for high school students. Okay, so about a year ago, Providence Health and Swedish came to us with an idea that they wanted students in the 11th grade, they recruit students in the 11th grade, give them an internship, and then they come to us for the didactic portions of these particular programs. One program is a clinical engineer. This one is a person who basically they troubleshoot and fix medical equipment. And so we have an affiliation agreement with Bates Community College for students to finish the associate transfer degree there. They come to us, they get the certificate, they go to Bates, and they get the AST degree. The minimum salary starting off is $56,000 for that salary. So you're talking about an 18-year-old individual making $56,000 to $58,000 a year. That's a pretty good salary, you know, depending on that. Now, if you get more education and more training, obviously the salary will go up. The second program that we're starting is called an Allied Health Project Manager. This individual will manage projects for health networks like Blue Cross, Blue Shield, Molina Healthcare, Swedish, so on and so forth. This is more of your administrative jobs within healthcare. I want to be clear about the different career choices within healthcare. A lot of students will come to me and say, well, I don't really like teeth. I don't like blood and guts. Do you have anything else that we can, you know, do? Because I'm really interested in healthcare because my parents said, you know, it's a viable career, which it is. So we do have medical office, which is medical billing and coding. We produce certified coders through a organization called AHIMA, which is the American Health Information Management Association. And then students can sit for their certification examination. With those particular careers, students are starting off around $35 to $38 an hour. So it just depends. If you're a person that likes to research and look up codes and, you know, things of that nature, that would definitely be something for you to look into. want to continue on and talk about, we also have what we call a medical assistant program. My medical assistant program, we just happen to have the #1 medical assistant program in the United States of America. So the reason why it's the best in the country is because our #1, our retention, and #2, our hire ratio. More than 95% of our students are hired on their clinical rotation. And it's not because companies are just taking them, but one, the medical assistant is in such demand today. But it's also the skills that they've acquired while at Renton Technical College. So in the medical assistant program, medical assistants work in the forefront of medical care, helping physicians and specialists with medical procedures and administrative duties. It's a good profession for someone who wants to quickly enter the field of healthcare. Students in our program will learn how to set up patients for examinations, draw blood for basic lab studies, administer medications, and perform EKGs. They also assist with minor surgery procedures and perform front office and back office tasks related to medical records and billing. The program includes a clinical practicum, which I talked about, the clinical rotation, where students will practice their skills in the field. Students will prepare to take all of the 4 nationally recognized medical assistant credentialing exams. Passing any of the exams earns a person the credential to work as a medical assistant. Our program has an average retention rate of 90% and an average pass rate of the national exam of 93% over the last 5 years. The program's 2020 annual report for Medical Assistant Education Review Board shows an 89% retention rate and an 87% passes rate from 2018. So when you're talking about how many programs are in America, there are thousands. And one of the things to really look at is, you know, you're making a financial obligation. You want to get the best that you can get for what money can buy. I can honestly say that we have one of the best programs. Well, we have the best program, but I have to be partial. I mean, it's a really good program where students can start off and get into the medical assistant field. So Layla has a question. What are the things that I need to know if I'm going to nursing program to prepare myself? It's a good question, Layla. I think #1 is you want to do a thorough investigation. You want to do your research on the area programs. #1, are they accredited? That's #1. And the reason why I say accreditation is because in some cases, some higher level health networks will not hire a nurse unless they came out of an accredited program. That's #1. #2, you want to ask the dean or associate dean or the counselor at the college about their pass rates, their NCLEX pass rates. That is critical, because if they have a nursing program and it's accredited, but they're not passing the NCLEX, that means that their students aren't going to work. Because the NCLEX means that you are licensed as a registered nurse. If that NCLEX number is low, that means they don't have a lot of students that are out there working in the field. Where at Renton Technical College, we do. So that's, you know, and I would say that for even my sister colleges, same thing. There are a lot of our students that are out working in the field. Another recommendation that I would give you is to make sure you're taking the correct classes in order to get into a nursing program. That's critical because, again, we don't want you to waste time. We want you to make sure that you hit your sciences, you hit your math. So things like microbiology, things like chemistry, biology, Those things are critical to your admission to a nursing program. And then making sure, now I remember, the test is called a TEAS test. And the average TEAS score across America is about 70 to 75. My last two cohorts at RTC were average in the 90s. So those particular individuals actually could have went to any university in the country to study nursing. They decided to stay home and attend Renton Technical College. And now those individuals are actually working as registered nurses. So I have any other questions about any other programs? Okay, Tina. I'm currently enrolled in the Skills Center nursing program for high school students. I was conflicted between Skills Center and Running Start. Do you think I made a good choice? Well, I think that Running Start would be a better choice for you, Tina, because it is directly linked to that particular college organization and that particular program, where the Skills Center is not. The Skills Center is not a part of the SBCTC college system, but the Running Start programs are at every college. So I would definitely contact your area college. I don't know where you live, but whatever college you're close to, contact them, get in contact with the Running Start coordinator, and that individual can get you on a path, an allied health path, to get into nursing school. And generally that path will start with your CTE. Okay, thank you. It will start with your high school CTE director, their pathways in terms of allied health careers, the classes that you're taking there at the high school, and then what classes can be transferred over to the college level. Because the dean at the college can take certain credits from your high school if we have an affiliation agreement with that particular high school. So that will make it a little bit shorter of a pathway for you. Again, we don't want to waste time. We want to make sure that whatever classes we're taking are going to be beneficial to your career and will also help you to obtain eventually a degree in nursing. Okay. So I was talking about medical assistant. Our program is, for the certificate program, it's only 4 quarters. And then for our associate program, for the Associate of Science, it's 6 quarters. And for the associate transfer degree, it's also 6 quarters. Now, for a medical assistant, they start off making around $32,000 a year, but with additional training, that can go up to, $50,000 or more. And my suggestion is, if you decided to major in medical assistant, to learn a specialty, because with a specialty, you will make more money. And when I say specialty, I'm talking about pediatric, I'm talking about cardiovascular, I'm talking about, things of that nature will give you an opportunity to make more money. When you're just a general practitioner, generally they start off around $15 an hour, which is the equivalent to about $31,000 to $32,000 an hour. But again, if you're certified, that's going to be more money, but also the specialties will give you an opportunity to make more money or more salary. Now, at my college, my background is healthcare IT or healthcare informatics. One of my degrees is in that, and that's what I did for a career. And a lot of times when my programs are going through that part of their program, I go in and I do a guest lecture. And a lot of times students don't realize the money that they can make from the health informatics perspective. So in all of our programs, we have that particular option. And a lot of times when I do the guest lecture, students are like, oh, I wish I would have chose that as my major, because I didn't realize how much money, that they make. Not necessarily about the money, it's about what you love and what you enjoy. For me, it was something that I enjoyed doing. And I stayed in it until, you know, even when I got into education, I still was working on that side too. But my recommendation to all of you is choose something that you truly love. For me, I love education. I love helping people. So here I am, 25 years later. So, you know, get into something that you feel is your niche, something that is going to, you know, be something that is make a choice that's lifelong. Because again, you're a lifelong learner, but something that you look at and say, you know what, 10 years from now, this is something that's still going to be here. Healthcare will always be here. The thing is, the only thing that will change in healthcare is technology. And so with that, you can still go get training, additional training for that technology. So I would definitely recommend that for those of you that want to get into healthcare. Definitely a great field to get into. The next program that I'm going to talk about is medical assistant phlebotomy. So our phlebotomists are individuals that do blood typing, and the majority of it is drawing blood, what we call venipuncture. Phlebotomists are the specialists that draw blood from patients for testing and transfusions and other medical or research procedures. These individuals are prepared to work in medical offices, clinics, labs, and other healthcare settings. The students will study the history of the field, legal and ethical issues, and the clinical settings where they work. They will cover areas such as basic anatomy and physiology, medical terminology, and infection control and prevention. Students will also study and practice skills such as blood drawing techniques, special collections, and how to prepare or process specimens, and how to follow OSHA safety standards and requirements. The program also includes participation in a national certification examination. Now, this particular program is only 1 quarter. And our students come out of RTC making around $32,000 after 1 quarter. That's only 11 weeks. That's not a long time. So I would definitely say if it's something that you're interested in doing to get into the healthcare field, phlebotomy would be an excellent choice. Tina has another question. Would taking Skills Center next year, my junior year, and Running Start for senior year be a good path as an aspiring RN? Tina, I would say do Running Start for your junior and senior year, both, because it's going to give you a direct path to an RN program. Again, coordinate with that with the Running Start coordinator at your high school or at the college. I'm sorry. Coordinate with your CTE director at your high school and the Running Start director or coordinator at the college. They can give you, you know, a direct path of what that's going to look like. But from my perspective and my role, I have students in the 11th and 12th grade that come into my programs for associate transfer degree pathways. So both 11th and 12th graders are there at my school now. That's a great question, but definitely you want to get on the path now and stay on the path for the 2 years so that you can go directly into a either a direct transfer agreement program, or you will take the prerequisites for the nursing program. Now, Tina, what I will tell you too is it's not going to be a quarter or two. Generally, when my students take prerequisites for the RN program, generally at minimum it's about 2 years. Okay, so just understand that it's 2 years and you're coming out with minimum 2.5 grade point average depending on which college you decide to apply to. What I would do, I would get into taking the courses, and then once you finish or right before you finish, I would research at least 5 programs and I would apply to all 5. You don't want to limit yourself just to one program. But yeah, great questions. As I was saying, we have a phlebotomy program. It's only 1 quarter. and the students come out making around $32,000 a year. That's one of our programs that is not financial aid eligible. That's a cash paying program. It's about $1,600 for an entire quarter, but again, the outcomes are great. My instructor has taught this particular program for the last 23 years. Her record is outstanding for the program. I would say this: when you go to your doctors, when you go to the hospital, chances are it's one of our students that are taking your blood. It's funny now to see students. You know, I was their dean before. I go to the doctor now, and my students are taking my blood. It's like, no, I'm not your dean anymore. I'm your patient. Go ahead and take my blood. And they're afraid to do it. It's like, no, I'm not. I'm not your dean. I'm your patient. Take my blood. You know. But it's good to see that they're out there working. Very proud of the accomplishments that they've had. Any other questions before I move on to the next program? Okay, so one of the other programs that I had talked about earlier is a medical coding specialist program. That program is one of the programs that you don't have to draw blood, you don't have to touch people. This is more of an administrative side of healthcare career. Healthcare these days is complicated, and it's a layered system of specialists, providers, and insurance companies. For these layers to work well together, they need to speak the same language. Medical coding specialists are the first step in this process, translating information about a patient into standard codes and terms that will be understood by all the different people and organizations involved in healthcare. In this program, my students study medical terminology and standardized codes for diseases and conditions. They will also learn how to use word processing, spreadsheets, and computerized patient accounting to enter information into medical forms and records. Currently, this particular program is ranked #2 in the United States of America. This program is 6 quarters. You would obtain an Associate of Applied Science. And our students come out making around $46,000 a year, which isn't too bad. Okay, Ms. Pratt had to leave. She left us a message. Okay. Do I have any other questions about any other programs, nursing, MA, CNA, phlebotomy, any of those particular programs? Do you guys have questions about the pathways, about the NCLEX, you know, general education courses, anything that I can answer for you to help you to get on the path? Anything you can think of, I'll answer it for you. If not, I'll move on to the next program. Okay. Let's see. What do you need to get to CNA? CNA doesn't require anything. I mean, at 16, you can go into a CNA program. You just have to apply, basically. Like I said, most students that are in our CNA program, most of them never had any allied health experience at all. It used to be where in the state of Washington, one of the requirements to become a nurse was to actually have your CNA license. You don't have to have that anymore. You only have to have some type of allied health certificate and or allied health degree in order to get into a nursing program now. So at 16, Layla, you could actually apply for a CNA program and go right into the CNA program and get the training to become a CNA, and then sit for your national examination after you complete the program. So I have high school students now that are in my CNA program, and a lot of them are high school age students just looking to get into the healthcare field, which I again think CNA is a perfect segue to getting into the healthcare field. So I'm going to talk about CNA next. It's our Certified Nursing Assistant program. Nursing assistants work in hospitals, clinics, and long-term care facilities, retirement or assisted living facilities, adult family homes, and in-home healthcare. They'll provide quality healthcare and assist nurses in their work. The nursing assistant program prepares students to earn their certification and work in a healthcare setting. It is also the first of the career ladder for students to become licensed, practical, or registered nurses. Well, not anymore, but it helps. Students in the program will learn about patients' rights, basic bedside nursing skills, patient and personal safety, and HIPAA and HIV/AIDS education. Students will also practice their skills in acute hospitals and or nursing facilities. So our CNA program is only 5 weeks, and students come out making about $20,000 a year for CNA. Fernanda has a question. Do you think the program will help us if we're not sure if we want to become a nurse? I would say definitely yes, Fernanda, because it kind of gives you that entry level look at what the responsibilities of a nurse will be on a day-to-day basis. So definitely yes. It's only 5 weeks. And the positive is that once you acquire the skills and you take your licensure examination, you can actually go to work after that. So come into the program, take the program, acquire the skills from the program, go into an internship, and then practice your skills that you learned in the program, take the licensure test, and then you go to work. So definitely it is a segue to becoming an RN. I see I had a lot of people in the chat that are interested in becoming RNs. What I will also do, I will put the address of the SBCTC website. And what this is a, I think it went to, let me send it to everybody. What that website is, it actually is to all of the colleges within the community college system within Washington. You can click on that link and you can look up the different programs that they have in their area. So Layla's question is, can you take the CNA before going to nursing program or after? It just depends. In levels of education, you would take the CNA first. Most students take it first. Juanita has a question. What can you do to be in a path of becoming a, is that pediatrician or predication? Okay, so for pediatrician and pre-med, I would suggest that you look at some of the colleges that I just posted. Look into one of the community colleges that have a pre-med track for going to get the bachelor's degree. Or they may have particular classes that you will need to take in order to obtain the bachelor's degree for pre-med. So you can take either pathway. So that's a great question, Juanita. So utilize that website, whatever college is in your area, look to that particular college, go in, take a look and see what they have, contact their counselor or contact their allied health dean or their nursing dean, and that individual can help you to get on the path to becoming a pediatrician. Great questions. Do we have any other people in the chat that are interested in any other careers other than nursing and CNA? Okay, so I will talk about this. I think I have one more to talk about, or two. We also have a pharmacy technician program. And basically, pharmacy technicians work in pharmacies. They also prepare medication and assist pharmacists with other duties. Our program offers valuable skills such as how to compound products, mix intravenous solutions. They apply math for pharmaceutical calculations, and they learn how to use computers to process orders and keep records. The program emphasizes detailed knowledge of products and drugs. The program includes an externship in retail and hospital pharmacy. Students will earn a Washington State Board of Pharmacy license to work in this field by passing a national certification exam. Support for the program is available through a grant and through financial aid, also through eligible sponsors. So we have a lot of different pathways at RTC. Pharmacy is another one. We just created a pharmacy assistant program that is only a quarter. So 11 weeks, and our pharmacy assistant students will go to work. For the pharmacy tech career, they start off around $30,000 a year. Pharmacy assistants start off around $25,000 a year. I have one or two more to talk about. Well, no, registered nurse, of course, the one that everybody is interested in. So we accept applications for our nursing program, and we make sure that students have a checklist for registered nurse. And what I'll do, I'll put in the chat the example of the particular application and what it looks like. So you guys can kind of have an idea of what our application process looks like. But what I will tell you is we look at the science, we look at the math, we look specifically at those to see, you know, what were your grades in science and math? Because coming into a program that is taught specifically like a registered nursing program, if your grades weren't great, I would say, in those particular disciplines, you might have a harder time successfully completing a nursing program. So we basically will look at that and bring students in for an interview process as well. Our nursing program is 6 quarters. And generally, when our students pass the NCLEX and are hired on the job, our students are starting off around $72,000 a year. Now, that's a lot of money, but it's also a lot of training. And I'm a person who believes in telling my students the truth. These programs are extremely competitive. It's not impossible for you to successfully navigate the program, but it's a harder road with a nursing program. But it's a career that will be around for a very long time. But I think you guys have asked some really good questions about how to get into the nursing program. Like I said before, it is contacting counselors, it's contacting the dean, it's also working with Running Start, it's also working with your counselors on your campuses now to talk to them about, you know, different pathways. I will also put my email address in the chat, just in case you guys have additional questions that you may want to ask me later on. You can email me directly at my email address. It's ccarter@rtc.edu. You can also contact me at the school. I'll put my number here. As well, where you guys can actually give me a call. You know, you may think of some questions later on that you may need answered. I don't mind if you go to another college. If you just want to be advised on what to do, I will, you know, get you on the right path, get you to the correct college or the right dean or whoever it is that you might need to talk to. I have 2 other programs to talk about. I think I have 5 minutes to do that. One of the other programs is surgical technologist. It's also one of our degree programs. It is a transfer degree that is 6 quarters, and our surgical technologists come out making around $45,000 a year. They work extensively with surgeons and surgery arenas. So they are there with people to actually that actually perform surgery. And then my last program is veterinary assistant. We actually have a program there that deals with animals, and every particular instant in terms of what, the anatomy and physiology of the actual animal. Vet assistants work in animal clinics and hospitals, as well as zoos and shelters, and in the field to take care of animals under the supervision of a veterinarian or other specialists. Assistants are often the first point of contact in a vet office, and they can make the experience less stressful for injured or sick animals and their caretakers. The program prepares students to assist veterinarians with surgical and nursing care, laboratory procedures, administering medications, and more. Our program at RTC is the only one in the state of Washington that is accredited. And our program includes classroom theory, lab work, hands-on experience with animals, and internships in local vet clinics. So again, if you guys have any questions, again, you can utilize my email address or my telephone number. You can contact me and reach out, and I will answer any questions that you guys have about any of the allied health careers. Again, it can be at my college, which is RTC. Again, I'm Christopher Carter, and I'm the Dean of Allied Health and Health and Human Services. Again, we have about 15 programs there at the college. But again, if you are interested in other colleges within the system, I can connect you to other deans in the system that can help you to get on the correct path. Do we have any final questions about anything? Okay, Ken.
All right, everybody. That will be it for this session. Thank you so much, Christopher. Very informative and very thorough.